we are about to begin our panel discussion on sexual harassment, focus on the doctors, which are the hidden victims. We have Professor Dr. Dayang, who is the Director of Tun Fatimah Hashim Women's Leadership Center and also a representative from the National Council of Women's Organization.
Hello, good afternoon. Assalamualaikum. I'd like to thank MMI for this kind invitation. I'm a pediatric surgeon by profession. Been a pediatric surgeon for some time, from 2001. Currently I'm holding the post as director of the Tun Fatimah Hashim Women's Leadership Center. I got the invitation through NCWO as I'm the co-chair of the health committee for NCWO. So I'm quite excited to learn from my fellow speakers actually, and from Isabel, and also Dr. Lian, who's working very hard for this topic. Congratulations.
Thank you, Prof. Dayang. As for Malaysia being a multiracial country, there is definitely different perspectives on how sexual harassment is being viewed. So there must be many cultural norms that would have a different view of how sexual harassment is like. So for the cultural perceptions of sexual harassment in Malaysia, what are these perceptions? And if it's possible, maybe the next speaker could give us an example of how these scenarios would play out. So this next question I would like to direct to Prof. Dayang. What are the cultural perceptions of sexual harassment in our country?
Thank you, Lian. Actually, Dr. Lee has touched some of it being cultural. It's the three main ethnicity in the country: Malay, Chinese, and Indian. There's a study in 2015 looking at the sexual harassment in undergraduates. The number of participants, the number of samples, about 200 plus. Majority were Malays. And when they screen through, it's very interesting that despite being Malay, Chinese, or Indian, the number one type of sexual harassment is actually verbal. Okay, the differences is the way it is expressed. Yeah. So, for example, for the Malays, they might make comments about how you look. I wish you look. You are fantastic. I wonder how you would look if you wear a see-through dress, for example. Yeah, that would be probably how the verbal harassment is for the Malays. But for the Chinese, they're more direct. I read the article and I was a bit stunned. The way the samples express the type of verbal harassment they got. It appears that the Chinese are a bit more bold. Can I touch you? Can I have a feel of your breast? It's very, very bold, and truly, that's you can tell this is just very hard facts. Yeah. For the Indians, they're more subtle. They send images. It's verbal, very little verbal, but a lot more images. So that is the type. That is the cultural aspect when when the type of harassment is concerned. But I think more importantly now is how one is being brought up. Whether you're whatever ethnicity you are, in your family, whether you are brought up in a environment where the dignity of woman is emphasized. Okay. So naturally, we also have to touch on the religion. Okay, so it is assumed and expected that the more, if you practice your religion, then you will have you will not try and harass anyone. Not even sexual harassment. Okay, any type of harassment you won't do. Okay, you treat people respectfully. But of course, the level of knowledge about the religion of someone is different from what you practice, right? And it also affects other environment affects you as well. How you behave at work is different. Yeah, you look at Malaysian. I could be a professor and very kind to you, but when I start driving, I'm a totally different person. Yeah. Is that the environment changes you? Yeah. So going to the topic today, I find that doctors, there are certain culture at work and certain discipline that is more prone for sexual harassment. Yeah. This may be anecdotal. I don't think we have statistics, but over the years, my years of practicing surgery from 1996, I see a lot in the surgical field. Yeah, certainly more than what are the number of cases that has been reported. Also look at that environment. So the culture at work involve the discipline you're in. If it promotes accepting jokes, dirty jokes as part of growing up in that discipline, that could be very disastrous to women.
Thank you very much, Prof. Dayang. Yes, that is a very true fact, very sad, but a very true fact that sometimes the environment also influences the kind of the level of acceptance we have, when it comes to situations such as these. Stemming from that discussion that we had regarding the long-term and the short-term measures regarding harassment, I actually have one very interesting question that I felt that is very related to what was just discussed. And this question actually is directed to Prof. Dayang. So as this question goes, as a leading surgeon, Prof. Dayang, did you encounter gender discrimination while pursuing your career? And was there any action taken? And what was the outcome of the incident, if any?
Like, so you're asking my personal experience, yeah? Definitely, yeah. Well, in the 90s, they're not, for pediatric surgery, women were leading, okay? In the country, female pediatric surgeons were more common than the male ped surgeons, or about equal. So in pediatric surgical fraternity, I didn't feel at all threatened or there was biasness. But well, if you asking for personal, then I have to tell the truth. You see, when I was doing orthopedics, I remember when I was in a service MO and I had to do rotation as part of my fellowship in Royal College of Surgeon Edinburgh training. So I recall certainly it is a male-dominated discipline, and as someone who has to rotate, you need to fill up your logbook. You have to listen to all these dirty jokes. It's just unbearable. Yeah. So I recall expressing myself. I think I know everybody take turn to speak, but I really want to say, if you're a victim, you need to speak up. Yeah. You need to tell somebody you're not happy. Okay. You could be telling your BFF, you could be telling the nurse, you could be telling your MO, if you're houseman, MO, consultants, yeah. You need to tell it first to someone to get it off your chest and make sure you're safe. I recall when I was not happy with the amount of dirty jokes, I was immediately penalized. Yeah, when I mentioned it to the MOs, they said, "Well, then don't come in. If you are not happy, don't join the theater." Okay, so that is a penalty to me. If I want my logbook to be filled up, of course I have to tahan lah. I have to put up with it, right? And I come from a different. My father was in the army intelligence, and he emphasized how women should be street smart. Yeah, and you need to voice out, and you need to tell your father or your parents if something goes wrong. So I ultimately informed him, and he just said that you have to tell the boss, which I did. I went to the head of departments and I gently told him, he's a very nice man, and offered. He even asked, what could we do? Well, what would you suggest? And at that point of time, I decided I don't want to be in the general pool. So I decided to spend most of the time in the pediatric orthopedic pool, yeah, where being with children, I don't see that much of, it's inappropriate to be said telling dirty jokes in front of children. So I felt nicer. Okay, that's my personal experience. That was during training. But as a professor, I know for the fact that there are many levels of harassment my trainees have to undergo. They put up with it because, and mostly verbal, some are physical. Yeah, they put up with it because they want to pass the posting. If I speak up, Prof, I'm worried. I will, yeah. So some of them even say, I will let us pass the exam, Prof. I'm very worried. Let us go through this, and then after that you can come back. And at the end of the day, none would want to put in writing. It is a tough thing to put in writing, yeah, for a lot of people. So I understand the predicament, and I think the first step for me is, acknowledging there's a problem, and not be afraid that there is support. People say put the support at the end, but actually no. You got to tell doctors, young doctors, this is not right. You need to feel safe, and you need to tell someone. These are the appropriate channel, as Betty was saying. Every institution has their policies. Yeah, most institution now has policies on how to protect the victim and make complaints. It's done very in the university, in UKM, and most research university. It is through the integrity unit. Yeah, you can make a direct complaint. You remain anonymous. You are protected. Okay, so my advice is, wherever doctors, young doctors or trainees, you have to know the protocol in your institution first. Okay, you know what are the options, but when it happens to you, you need to tell, like what Dr. Lee was saying. You need to, not to say no, but to say how that's not comfortable. And it can happen one to one. There are people who do it behind. They look so benign, but they take all the opportunities as you go down the stairs alone with them when they are returning favors. I do your call, but after this you have to do something for me. Okay, when you are on call, you have to be around together all the time. And remember, for healthcare workers, for doctors, you not only get sexually harassed by your someone higher than you. It could be your colleagues, it could be patients. Okay, patients are also capable of sexually harassing you. Yeah. So in the past, when I was a medical student, when I was a young trainee, I do not need chaperone. Only the male doctors need chaperone when they examine. But that's no longer true. Okay. So now you have chaperones all the time. Okay. Whether you are examining a male or a female patient, you need to have chaperones. Okay. Protect yourself so that a presence of a third person will usually stop the incidents from happening, unless you are in a position of power. You see, you are in a, say, operating theater. There are more people, there are a lot of people, but because hierarchical, you are lower. So the person who probably harass is higher than you, and you are dependent on that person to for either your marks or passing, signing your logbook, or giving you marks, giving assessment. Yeah, whatever it is, you have to tell somebody about it, and then go through the proper channel that the institution has. If you don't go through the proper channel, the merit of the problem get reduced. Yeah. And in every department, in every field, there is somebody that you look up to. In a group of you, can either your lecturer or your consultant or a senior nurse or your colleague or your mom. Yeah, there must be somebody you look up to. So tell them, so that when things are not easy for you to handle, you can't think straight, somebody else is doing the thinking for you.
Thank you, Prof. Dayang, for sharing your experiences with us. I think it's quite eye-opening to know that this is not something that has been happening only just recently, but has been happening for a long time now. And calling it out, I think, is one of the first steps to making not only ourselves, but also the people around us realize that these problems exist and it's not a dramatization or over-exaggeration of the situation because of the feelings that these victims undergo, the outcome of the situation, like for example, what Prof. Daya mentioned, the outcome of the situation being that, she's being uninvited to the theater. So this is just one of the many examples, I think, that we also have to be aware of remarks like that being a dismissal of your presence or your capabilities because you don't agree to something that is harmful to you. Interesting to note, that underreporting is actually something that is, when you don't report, people are not aware. And I think that's one of the few reasons why there hasn't been any data, because our reports are actually too low for people to notice it being a problem, even though yes, somehow one way or another, many uncountable people yet have felt have experienced harassment. So reporting actually often leads to retaliation, as I believe it was mentioned earlier. And this retaliation is quite severe towards the victims, not to the perpetrator. So when these things happen, how do we actually want to address this?
Lian,
Yes?
I always feel an institution and as a leader, it is better when you do your 6-monthly or annual report. Not only you report your achievement, you must tell how many complaints you get, and that includes sexual harassment cases. It was such a breather a couple of months ago when the Integrity Unit of University Kebangsaan Malaysia, they held the same thing. They had a webinar on sexual harassment, the thin line between jokes and true harassment. Okay, and it drew over 5,000 response online. Yeah. And I was very happy when the Integrity informed the top 3 complaint the last 3 years. One of them is sexual harassment. In 2019, we have 2018 we have this many. 2019 we have this many. In 2020 we have this many. In 2021, the last 2 months we have this many. There's no shame in announcing it. Okay, naturally, we don't know whether the cases are true or not. When somebody complain, we also look at whether it could be a wrongful exercise. That's how the female may take advantage of it. But today what I'm trying to say is, if the institution is happy, is proudly saying, they manage I totally agree with Betty. Mention, and part of their KPI is to inform the public. These are the many complaints we get and how many is solved, meaning we know this is true, it's not true, what has been taken, what action has been taken. Then I think it elevates the standing of the institution. So an institution and a leader who encourage the subordinate or the team to speak up and offer pathways to handle sexual harassment cases in the workplace, especially in the hospital, should then be promoted, okay, and should then be highlighted, to set a good example for others. I think that should be the new culture. And you talk about retaliation. Some retaliation is immediate, you give and then something happened to you. But in all honesty, in surgical discipline, for example, the retaliation can come later. Oh, you buat report pasal you report for me, I'm going to take you. Be careful when I take you later, or I will not sign you up. Okay, so how do you prevent that? So as office bearers or those who are in power, take up the complaint and ensure that the victim do not cross pathway anymore. Find another assessor. I think there should be, this is when we talk about policy, Betty? Every institution have its policy according to the need of that institution or discipline. Okay, why? To protect the victim immediately for safety. Secondly, to protect and prevent retaliation. Okay, immediate retaliation or a delayed retaliation. Yeah, and that should be spelled out. And the action should be within considerable good time, not 1 month, 2 months. And by the time, let's say they do short posting, habis dah, they finish the posting and then you still have not done anything to it. Yeah. If I may, I think immediate as a victim, or let's say you're in a WhatsApp group. Now all doctors have WhatsApp group. Yeah. WhatsApp group for this, WhatsApp group for that. If somebody start telling dirty jokes in there, you must be bold enough to say stop it. Yeah, it may not be addressing to that person, but the key member, other members in that WhatsApp group must, especially women, you must say this is inappropriate. Stop it, please. This is inappropriate. Because being silent and wanting to say, oh, I hope these jokes will die off. Even in COVID, they will find dirty jokes to talk about. Yeah, so I would think to stop retaliation again, no, and it could be a report or an immediate as it happens. And I think in this era now, you find it more rampant through WhatsApp, through social media like Facebook, Twitter, and so forth. Yeah. So do it then. Yeah? And if a follower find that that's wrong, you retaliate by putting a stop to it. Yeah. So retaliation, that's a positive retaliation. Yeah. Thank you.
Thank you, Prof. Dayang. Actually, there is a somewhat related question to this in retaliation. So far, we've been talking about retaliation towards people who are superior to us, somebody in the same field, in the same department. But for harassment from patients, is there a way that we could actually, for example, we are in charge of a ward, we are treating that patient, we are assigned to that patient, and that patient has sexually harassed us, in one way or another. So, for example, if we have no choice, if we were the only houseman medical officer in the ward, that a lot of cases for some district hospitals where there are very few staff, what happens to, this, in your experience, if you have, been in this situation, or if you know someone in this situation, does the harassment from patient cloud our judgment and affects the quality of care we give to the patient? And how can we combat that? So this question, I will either Prof. Dayang or Dr. Lee.
That's the easiest actually. If you are harassed by the patient, you stop. You tell your consultant. Okay? Just tell your consultant. And as a consultant, I would say as a doctor, you interact. Your responsibility to your patient is until your safety is up to the point where your safety is maintained. The moment your safety is jeopardized, either people put a knife to you or threaten you or sexually harass you or physically harass or verbally harass, even not sexual, that safety net breaks. Okay? When that safety net breaks, you are no longer responsible for the patient. So you must tell the patient, I will no longer be responsible to you. I feel harassed by you. I will now report you to my superior. And you walk away. Okay, you walk away because you don't engage in exchange of words, getting angry, taking pictures, video, and then putting on your Facebook. Okay, so you just tell your consultant and let your consultant handle it. Even if you're the only houseman, don't worry about it. You just tell your superior. Hopefully your superior is not as bad lah. Yeah. But a responsible superior will protect you first, and we just get the replacement for you. So that's the easiest, and I've done that before for my MOs and my housemans. Yeah, to me, I do not put my staff, my nurse, or my doctors to be harassed by patient. Yeah, Okay.
Thank you, Prof. Dayang. Yes, that is a very good explanation to that. And we should always remember that for those of us who are familiar with the basic life support, the first thing you think about is danger above all else. Danger whether to yourself or to your patients, but more importantly, individually make sure that we are safe first. So from part of what Prof. Dayang mentioned earlier, when it comes to dealing with harassment, Prof. Dayang mentioned social media, posting on social media, which brings us to the next topic at hand. Is social media an effective tool in reporting sexual harassment? In the last few months or last few years, there have been many people who have turned to social media to express their experiences of being harassed. I've seen one recently also where this lady was being stalked in a mall. And however, this lady did not turn to the authorities. She turned to the social media to let her story be known. So this topic is an open topic. Is social media actually an effective tool in reporting sexual harassment? Open to any of our members to answer.
Depends on the type of harassment you get, I feel. If it's leading to sexual assault, get yourself, if you want the perpetrator to be penalized, right? Okay, you don't want to embarrass people, but social media can be used to share your experience so that others are aware. You need to create awareness. Social media is fantastic to create awareness, just like what you are doing now. You're creating awareness. Today I was at the exam meeting, and I usually get very tired after the day ends, and I've got another day of examining. But I take up your invitation. I don't give to my co-chair of the committee because this is a very important topic, and you used a social media platform to make public aware. So I think that's important. We are not in doing so. We share some of my personal experience and so forth. Yeah, I'm not trying to embarrass anybody, but we are trying to create awareness. Yeah. So, but if you are serious about taking down a perpetrator, and you should, if it is a serial. Sometimes some sexual harasser, they are serial because they know most women are keeping quiet, and those are the one you want to take down. So you can go to the social media to create awareness, but you need a formal complaint. Yeah, it could be through your institution first, and then later on with merit. If you go through the integrity of the integrity unit of your institution, if there's one, they will then be able to advise you what legal channel you'll be able to take. That would be my advice.
Thank you, Prof. Dayang. And I also, on behalf of MMI, appreciate so much that you agreed to this session, in the midst of work, in the midst of Ramadan month. I really appreciate
No
that.
worries. Yeah.
Yes. So yes, it is. I would say, yeah, I would also agree with what Prof. Dayang has mentioned. Social media being an important tool of realization, but also a formal complaint channel needs to be engaged, because without the proper legal action taken against these people, they, like Prof. Dayang has mentioned, these serial harassers will continue harassing, and they would just go unnoticed, or they would just go scot-free. And that is something that we want to prevent. We don't want the same incident to repeat itself. We don't want any other woman feeling the same way as we did when we were harassed. So this is sort of, by doing this also, we are strengthening and empowering other women to also speak up and to help them to realize that harassment is not something that you should just keep hush-hush, keep it to yourself. It's something that you really have to be bold enough to speak up on. And that's why this awareness is so important, not just for the ladies, but also, for anybody, so that you can recognize if the people, sometimes the victims themselves don't seem to recognize it, but the people, we as the people who see it, can help protect these people, unknown victims as well.
Yeah, actually, we do have that. We not just sexual harassment. We do say, we don't tolerate any harassment. I think all MOH and all hospitals have that. But I think is the fact that the perpetrator, they think, oh, I was just kidding. She's so pretty. I'm I'm just kidding. This is when I think the safest for the young doctors is to inform your superior and let the superior tells the patient. Yeah, in my own experience, I will come up to the patient and say, you know, what you had just did to my MO is not tolerated here. Okay, but you are our patient, and we are responsible to treat you. So I'll give you somebody else, and that's it. Yeah. First and foremost, we have to protect the person. Even if the perpetrator, the patient says, "No, no, no, I didn't. I will apologize." Okay, you can do whatever you can apologize, but you know, the person is not treating you anymore. I have other doctors to cover. Yeah, because you put a stop to it. Just put a stop to it. There are certain things that you don't give second chance. Okay, one of these is this. Yeah, because everybody, I think, likes to say it's a joke. We're just kidding. Don't be too sensitive. Yeah, but if the doctor themselves come up to me and say, Prof, I feel I investigate, I see whether there's merit about it, and I'll take action. Then when it comes to patient harassing my staff. Yeah.
Thank you, Ms. Betty and Prof. Dayang, for addressing the all-important issue about patient harassment. The next thing actually I want to address is about the health outcomes of sexual harassment and violence, in the sense that these situations that people undergo, we've spoken about retaliation, we've spoken about the outcomes on the on the victims themselves, especially the things that they might realize or do not realize. But when these things happen to somebody, what are the outcomes of the victims themselves in terms of health? So, for example, can mental health issues stem from these kind of situations?
The most traumatic one is, you're harassed, and after that, your superior don't believe you, so it's more traumatic. Yeah. So in my experience, that is worse. So that really can cause depression. Yeah. And most of them don't want to come to work, and they take MCs, they're not happy. Okay, they start asking to change, posting or complain of body aches and headaches. I think when there is a change of working etiquette for somebody, the one closest to them, yeah, you in any discipline as a doctor, you close ranks, you have close people who are close to you. So it's very important, and you work as a team with nurses, with MAs, with the attendants, yeah, with your bosses. So you've got to be aware if there is a change in the behavior of work, they don't come up or something is happening. It may not be sexual harassment, yeah, but it could also be sexual harassment. You don't know. So what I'm trying to say is, ask them, why is there a change in the way they behave? Has something happened? Okay. And if you find that they are unable to speak to you, you just, would you like to, we talk about it outside work? Yeah, maybe it's not safe because walls have ears. Yeah. So I think that's my advice. Right? It's an advice rather than anything. Yeah. Thank you.
Prof, going back to the statement that you just told us about. So if the situation happens to be the victim realizes that he or she is being harassed, and they also approach their superior to address this issue, but what if the harasser denies whatever they have done, and then they say, you're just you're getting over yourself. You have to get over yourself. You're very sensitive. I was just kidding. If that situation happens, how do we defend the things that we have gone through?
Okay, this is when the SOP helps. You see, there is no. It is wrong when somebody complain sexual harassment to me, for example, that I bring perpetrator and victim together. alleged perpetrator. You don't do that. Yeah, sexual harassment, there is a specific pathway that every institution must follow, okay, to maintain the confidentiality of the case, right, and to protect the victim until the case is being investigated. And as a leader, you take this precaution. You listen to it. Yeah, you ask whether there's evidence, and if they are not happy to do the complaint, you should be doing the complaint. And I've done that. Yeah, I've done that on behalf of the victim. I have done that as well. Yeah, but at the end, the investigation will have to rely on evidence. Okay. So I don't think as a victim you need to worry so much what the people say. Okay, I mean you're the one who's getting it, and it is the leader or the office bearer or the person responsible when a victim complain to you. You're not going to tell the whole world. It is not right when something happened and you decided to inform others. Has this happened to you? I know. I was just wanting to check whether the same thing happened to the others. That's not right. Okay. First thing is maintain confidentiality, and there's a specific pathway that you have to do. Yeah, as somebody on at the top to protect the interest, the safety of the victim, and also the alleged perpetrator. Okay, because both sides can face embarrassment, kan? Yeah. But first and foremost, if you have evidence, strong evidence, there is assault. Okay, we have to make a clear demarcation here. If there is sexual assault, there is no two ways about it. It goes to the police straight away. Okay. So if somebody comes to me with sexual assault, I'm not going to say, okay, I'm going to report to integrity first. You know, this is an assault. Okay. So there's penal code on it. There's criminal act already. Okay. So take action accordingly. And every hospital, ada sebelah tu, there's next to it, there's always police station or police force responsible for the area. Okay, so take action that way. Thank you.
Thank you, Prof. We are going to steer a little bit away from the current topic about reporting and about the perpetrator. I'm going to address something that is actually a repetitive, is a very well asked questions among our audience. And this question goes, what are your thoughts about teaching sexual harassment as part as medical and nursing students' curriculum? That means part of the curriculum of medical profession would be on sexual harassment.
Yes, certainly it's doable. Yeah, it's in UKM, at least in UKM, I can say this. Yeah, we for the undergraduate and postgraduate, we have this module called personal and professional development, where we teach them to be leaders. We teach them to manage diversity. We teach them communication skills, and certainly we can embed sexual harassment or gender sensitivity issues. Yeah, as it is, we already have some portion of it. I don't think we spell out sexual harassment. That is for students, so we can definitely embed that in the undergrad and postgraduate personal and professional development module. In the hospital, I think it's very important if employer or the top management give a standard guideline what is acceptable and not acceptable, and what could be considered as sexual harassment, the type of sexual harassment, and do a short survey. I think it's very important. We are talking, and people are not knowing the burden of disease or the burden of issues. Yeah. So first and foremost, I always like to say, let's find out how is the situation in your institution, close to your heart. You could do a quick survey and then find out whether verbal is more than physical or more, what are the type, and you use this to educate. And especially if somebody is going for promotion, you want to tell them, you better make sure, you know, the male, the one thing that really hurts them is when they cannot climb the ladders, right? cannot naik pangkat is very difficult, yeah. So you should say take this seriously, because you know, you'll be investigated for this, yeah. And it works both ways, not just for male. It should also be for female, yeah. Sometimes I do find when I was working in other hospital last time, the closeness between colleagues, male and female colleagues. This is when social and religion is very important. Yeah? Well, maybe for a Chinese it's very okay to come very close, but for a Malay lady, that is harassment. Okay, so we in the teaching of becoming doctors, we tell them to manage diversity by knowing the limitation of social, religion, and so forth. Yeah, and that should be respected. Yeah, you cannot say, oh, I'm used to doing this, or I'm a graduate from overseas, this is acceptable, but you are working in the country and this is not acceptable. This kind of closeness is not acceptable. Okay, so before that happens, the way to prevent it is to tell. Yeah, in our working relationship, we would like uh, so and so. What are the guidelines? Okay, I think that's useful. I would, no dirty jokes in here, but you can do that because you're the superior lah, kan? When you're in the, you know, so it's important. The leaders must be correct, yeah, and the practice to enforce. I totally agree with that.
Thank you, Dr. Lee and Prof. Dayang. Actually, coming back to the hospital setting, is there any support care network available or any channel available, sort of like, for example, like needle prick injury, we have a set of algorithm SOPs to follow. Is there such a thing, similar thing for healthcare workers who are being sexually harassed? Either Dr. Lee or Prof. Dayang address this topic.
Not specifically mentioned this is a support group for sexually harassed, yeah, but we do have for the students, we have the postgraduate, especially we have a graduate assist. Yeah, so any type of harassment, any type of problem, not just harassment, any type of problem, they can say that. They may not want to speak, because not, you must understand, student may not want to speak to the consultants. They may want to just speak to the peers. Yeah, so you want to catch that first. You want to make sure they feel safe and there's somebody to listen, who can listen to them. So having in UKM, the postgraduate has what we call as graduate assist. We started this very recently. The postgraduate deputy dean started this. Professor Zarina started this last year, which I thought was brilliant. Yeah, and we had psychologists inside there, and we had also introduced a Jawatan Kuasa Ikhtisas. This is a professional level committee. Yeah, when it comes to sexual harassment, it goes to this committee. So the HOD will inform the committee, and we will investigate very, very quickly. Okay, I'm in that committee, that's what I know. Yeah, so this is also a new committee that we felt very important. As Betty said, you know, you curb them when they are students. Yeah, so postgraduate students are still students lah. We don't want them. When they become specialists, if you don't curb them, when they become specialists, they become rotten specialists. Yeah, so that's why it's very important to curb them. If you do the training when they are undergraduate and they become MOs, HOs, it's also very important. You may want to put it lightly, and you know, but when they are postgraduate doing their training to be specialists, we hit them a bit hard to make sure they don't do funny business like this. Yeah, so you need, when per case, we will address it very quickly. I can't say for any other university, but I'm sure every institution has a way of supporting, and this is one way of supporting it. That, you know, you deal with the problems the moment there is a complaint. You deal with the problem very quickly, and you address both parties. And nevertheless, if it is because we are talking about adults now, yeah, there will be police report being done. But for the students, you want to say, for medical doctors, yeah, you must remember you are bound by the Hippocrates Oath, yeah, and you have the medical Malaysian Medical Council, okay. And you have 3 acts. You have the criminal act. People can take action on you on the criminal act. You have the civil act, and then also the medical health act. Yeah. So 3 acts on us. Yeah. So you be careful. You may not be sued by the victim. You may maybe not be taken as criminal because there's no assault, but you can be deregistered. Okay, as a doctor. So I think that's how. I think that's my answer of how we can deal. It sounds a bit harsh, a bit strict, but we don't tolerate harassment. Thank you.
Thank you, Prof. Dayang. This is truly a new frontier as to curbing sexual harassment in hospitals, especially towards healthcare workers, because I think that something like that, a committee, a special committee, a non-biased committee to investigate these matters is actually quite important, as seen many instances in hospitals where superiors get protected because of their closeness or their relationship with people of influence or of authority in that particular setting. So I think it's a very amazing achievement to have, you know, in a hospital, and certainly a pioneering idea that I think that should be adapted by more facilities in the future. Another question I would like to ask from the pool of questions we have from the audience. Okay. Why are certain hospitals more toxic or more prone to sexual harassment than others? It's an anonymous question. Either Prof. Dayang or Dr. Lee can answer.
It's a very interesting question, isn't it? I can't
Yeah,
answer.
it's interesting. So interesting, right?
Yes, I can't really answer for, you know, it's I think, of course, the harassment is many types. Yeah, perhaps a toxic hospital means there are multiple type of harassment, not just sexual harassment. Yeah, I dread to think there is a particular hospital except the one yang the previous case where the doctor was dismissed. Yeah, eventually, I don't think there is a hospital that is toxic just because of sexual harassment, but environment can be toxic because of um, injustice that has been done at many layers. Yeah, I think to call a hospital toxic, there must be injustice at many levels. Yeah, and it could include sexual harassment or not discussing about sexual harassment complaint and so forth. And I hope we in 2021 in this era we do not put any of our doctors in a toxic hospital. Yeah? And that's not the way to work at any point.
Yes, thank you, Prof. Dayang. Owing to that question, do perpetrators actually face consequences, especially those in higher positions of power? I would say yes, in certain situations when the investigation is done and it has been proven. But in certain situations, I believe that a lot of people get away with it. So I believe this question has already been addressed. So I will skip this question.
Well, actually,
Yes,
you have to make the complaint and you have to come forward. Okay, so if you want, as I've mentioned, you can have it in the institution itself, the integrity unit, for example. Yeah, or you can also go to a police. You can also go to the Malaysian Medical Council. So there are many avenues if you're talking about doctors. Yeah, but you must come forward with the evidence. Okay, and you can continue to exhaust your means to complain. Yeah, helps comes when you want it. Yeah, but you have got to finish the job. You've got to go all out to have it.
So what happens, Prof, if we have no witness? This next question says, what happens if I have no witness and no proof? Only by word of mouth.
Okay, that happens when you have verbal harassment. That's quite often. Dirty jokes you cannot capture. I'm operating. Where got people record or but you are not comfortable. But you can go to your superior and say, this just now in theatre, this happened. Or just now in clinic, as I was showing this case, my MO touched my hand or grabbed my waist, or grabbed me from the back. That's not acceptable. You don't have witness, but the person you complain to, your superior, must know what to do. That has to be addressed. It cannot be put aside. That has to be addressed, and the person must be called and said, there's no did you do this? If you decide no, then I do not want you to work with the person again. You be careful. One more time I hear about this, I'm going to file complaint against you. Okay, I mean, take it seriously, because nobody should touch any part of our body, and I think that's why we want the sexual harassment bill to come out very quickly, because it's not tagged to assault, and we want to cover all type of harassment, including the one online and so forth, and a clear SOPs of how to manage, right, Betty?
One more question we have here. Does the title of doctor confer any protection towards harassment, or are doctors actually more vulnerable as they are trained to put patients first?
Definitely, we're not protected lah. Yeah, nothing. Your DR doesn't give you the license to harass people. But you are open to harassment at all angles. I find that is quite true. You are treating patient also can harass you, as what Dr. Lee is experiencing. I also I put in a CBD in a male patient, and he made a statement. So what do? I finished the job, but after that, I went to him and I said, that's not acceptable. You have to have that in you to say it. And of course, it's not everybody is comfortable doing it. If you're not comfortable doing it alone, you have to tell. And you're never alone in the ward. Never say you're alone in the ward, because you have nurses around, you have attendants, you have your MOs, you have your consultant, registrars. So talk to somebody about it.
Thank you, Prof. Dayang. Now we have something a little out of topic, but I think it's a very a topic that is trending right now. What are the speakers' view on the recent issue of period checks in the schools?
That's a no-no. Very simple. That's it. That's a
Yes.
no-no. Okay, I think even the minister has put a stand on it. That's a no-no. Okay, you don't do that. Is so not child friendly. Okay, I just I on the line of what Dr. Lee was saying. Actually, even in the university, when you want to go up the ranks, it pains me to see when they want promotion, there is no real check, because the protocol we have, let's say from promotion from doctor to associate professor to professor, all they look at is your number of publication, your research grant, how much network you have, how much money you bring. There's really not much emphasis on whether you have the other things, or you have been bad as a person. And I once posed this question. I said, why do you promote this person? And naturally, this is I'm asking somebody in a higher position, and the answer is, well, because in the guideline, this is what is stated for the promotion. I can't add anything more. Okay, this is the guideline given. Okay, so I look forward to a day when we look into other things. I don't think it is right to promote people when they are practicing sexual harassment. Okay, I don't think that's right at all. But I also feel that serial harasser, yeah, serial perpetrator, they, you know, they are serial, and I think all three of us have been repeating this many times. You have to make that complaint. You have to make it in black and white so that there's evidence that this person should be removed. In fact, yeah, if you say have more certain number and there's evidence, you should not be in the field of medicine, isn't it? Because it's very hierarchical. You have people under you and you can take advantage. So I look forward to a time when getting promotion will include looking at, like I said, some background check or maybe some psychological assessment. We can ask some question about sexual harassment and see how they respond. Yeah, it's sort of a screening tool or something. Yeah, a psychometric kind of assessment. I think that would be useful. I know it's useful when you are wanting this sort of test is important when you go for even higher position at the Ministry of Higher Education. For example, if you want to hold the position as, say, Vice Chancellor, you know, there's a battery of investigation or test that you have to go through. Yeah, but at the lower level, maybe I think we should do it. Yeah.
Thank you, Prof. Dayang. So I would like to ask all the speakers if they have any last words that they would like to address to the public before we end the session.
I want to say, be brave, okay? And in your institution, find a mentor, a person that you can look up to and stand for you, okay? And there are many. It can be your peers, it can be your superior, it can be just about anyone. Find that person, okay? Don't try and troubleshoot alone. Never troubleshoot alone. And remember, in life, one person is bad to you, there are 4 good person around you. Okay? Help is always there. So if you've been victim of sexual harassment, you're not alone. Continue to raise the issue, continue to get help, and help others so that they do not experience the same. Okay? Right. And thank you, MMI. Thank you, Leanne, Betty, Isabel, and Dr. Lee for sharing your experience. I totally enjoyed everybody's opinion and experience sharing. Thank you.
Thank you, Prof. Dayang.